Surgical operations. Abdominal incisions. This is the chevron incision. This is the chevron of a policeman. The Mercedes incision. Inverted Mercedes incision. This is the Mercedes landmark. Subcostal incision, layers of the abdominal wall, the skin, the rectus sheath, the rectus muscle, the internal oblique, transversus abdominis, transversalis fascia, extraperitoneal fat, and the peritoneum. The advantage of the subcostal incision is greater lateral exposure, less painful, less complications, heals well. Its disadvantages are longer operative time, closed in 2 to 3 layers. McBurney's incision and Land's incision. McBurney's incision, Land's incision. They are used for most of the appendectomies and can be used in the left lower quadrant for left side colonic pathology. The location of the McBurney's point is at the junction of the medial two-thirds with the lateral third of a line between the umbilicus and the anterior superior iliac spine. The incision is an oblique one and perpendicular to the line joining the anterior superior iliac spine and the umbilicus. The Lanz incision is more aesthetical and the scar is hidden in the bikini line if there is need for extension. The oblique incision is used with lateral extension and as a muscle splitting gridiron surgical technique. Muscle splitting is done in a parallel direction to the muscle fibers. Layers of the abdominal wall are the skin, fascia, internal oblique medially and external oblique laterally, transversus abdominis, transversalis fascia, extraperitoneal fat, and the peritoneum. The McBurney's incision and the Lanz incision advantages. Aesthetical incisions. Both of them follow the Langer's skin lines. A wide range of lesions in the right and left lower quadrants can be dealt with room for extension. Minimal muscle damage, muscle splitting, no nerve damage. Is a risk of injury of the ilioinguinal and iliohypogastric nerves which cross the appendectomy incision. This can lead to direct development of direct inguinal hernia later on. This is more evident with the Lanz incision. Pfannenstiel incision. Its use allows exploration of the lower gastrointestinal organs, the urinary and reproductive organs in the pelvis. Its location, it is a convex incision and the suprapubic skin crease 5 centimeters above the symphysis pubis. Once the peritoneum is reached, it is incised vertically, taking care to avoid injury of the bladder. The layers of the abdominal wall are the skin, fascia, anterior rectus sheath, rectus muscles, transversalis fascia, extraperitoneal fat, peritoneum. There is no posterior rectus sheath because the incision is below the arcuate line. Malar incision. It is placed some centimeters above that of the phalangeal and provides good exposure of the pelvic organs. It cuts through the rectus fascia and muscle as well as the external and internal oblique muscles. Once transversus abdominis and transversal fascia are reached, muscle splitting technique is employed. The advantage, the convexity of the incision parallel to the course of the segmental nerve minimizes muscle paresthesia or paralysis. Less scarring follows the skin cleavage lines. Each site hides in the pubic hair line. Its disadvantage is that it gives limited exposure of the abdominal organs, restricted use used mainly for the pelvic organs, high risk of injury of the bladder due to thinning of the fascia of the lower abdomen and uh, on forgetting the intraoperative bladder catheterization. Difficult lateral extension, difficult exploration of the deep pelvic organs, difficult dissection in obese patients. Thoracoabdominal incisions. Located in the right or left upper quadrants. Convert the pleural and peritoneal cavities into one cavity. It allows good access to the lungs, liver, and spleen. Good exposure of the esophagus and the stomach by the left incision. Laparoscopic incisions. They are small cuts in the abdominal wall skin. Their location depends on the site of the organ to be operated upon. They are 3 to 4 in number. One is always below the umbilicus to allow a port for the camera. The other incisions might be located in one of the 4 quadrants of the laparoscopic tools. Care of the surgical incisions. Closed with sutures, staples, strips, or local tissue glue. Keep the wound site clean and cover with a protective dressing. Instruct the patient to keep the wound as dry as possible to limit wound infection. Postoperative removal of the sutures or staples. Encourage gentle exercise and avoid pressure, pulling, and stretching on the wounds. Inform the patient that healing wounds might show itching, redness, swelling, or oozing of sanguineous fluid. Inform the patients that abnormalities in wound healing might occur, including infection, wound adhesions, hypertrophic, and keloid scars. Good luck and best wishes.